So a straightforward breast augmentation is a pretty quick operation. If it's not complicated, it's a primary, meaning the first time that they've had surgery and we don't need to do a breast lift at the same time. It will take about an hour of actual working time to do the surgery. It's about 30 minutes of extra time to go to sleep and then 30 minutes to wake up. So about 2 hours total in the operating room, and then you're in recovery for about 30 to 45 minutes. While you're waking up, make sure you're comfortable. Make sure your vital signs all look good before you're discharged home. So it is outpatient. You don't have to stay overnight or anything like that. And in your recovery period, it's about 2 weeks of recovery where you're feeling tired and not really wanting to do a whole lot. Some people a little bit faster. One of the things that we really love to use here and we recommend for most of our patients is a product called Exparel, which is a long-acting numbing medicine. It works for about 3 days. We inject it right into the pectoralis muscle, which is the chest muscle, during surgery. And that long-acting numbing really works to ease your recovery significantly. Because the part that really is most uncomfortable with a breast augmentation under the muscle is that muscle. It gets a little angry when we lift it up to put the implant underneath. So it goes into some spasm and causes discomfort. So when you have that long-acting numbing, it really makes things easier for people and they're moving a lot faster. You can usually shower about 2 days after surgery or so, 2 to 3 days, depending on your surgeon. And you can go back to doing computer work and stuff like that if you can work from home after a day or two, whenever you feel like you have the energy to do it. Most people stay out of work for about a week. Exercise-wise, you can go back to light activity, meaning taking some nice walks or a brisk walk, some light strength exercise. Make sure that's on enough. Some light strength exercises with your legs after a couple weeks. Full activity is after 6 to 8 weeks because we don't want you using your pectoralis muscle at all because we don't want to shift the implant where we don't want it to go. And we don't want you bouncing around on a treadmill or an elliptical for the same reason. And you're in a either a sports bra or a surgical bra for about 6 to 8 weeks as well. And that's just to let that incision heal, so we don't have any problems with the incision.